This is Hannah's physical assessment video. Knock, knock, knock. Doing hand hygiene. Hi, I'm Hannah. I'll be your nurse today. I'm just going to start off with a physical assessment. I'll just do the questions first, and then I'll do the actual physical assessment after we've answered them.
Sounds good.
Alright, so as my patient comes into the room, I'm just going to watch them walk and see if they're like stumbling or if they're having any trouble walking. And then once they sit, I'll look at their posture, see if they're slouching or anything, and I'll look at their like general body appearance, like if they're overweight, underweight. Look at their hygiene, if they look like they're in pain or having any distress. And I'll look at like their attitude, their behavior, if they seem really anxious or angry. And then when they're talking to me, I'm just gonna listen to their speech and see if they're like speaking clearly, slurring, they're mumbling, or like talking really loud. So first I'll start with the neuro questions. Your name and your date of birth.
Brett Sutterhaig, 9/23/98.
Perfect. Where are we right now?
The clinic.
Perfect. And then what town are we in?
Grand Forks.
Can you tell me the date?
April 9th.
What year?
2020.
Perfect. Then I would also check for symmetry in their face, if they're having any drooping or, and then if they have any lumps or bumps on their face. Next, I'll go into the cardiac questions. Any chest pain?
No.
Is there any activities that make you have chest pain?
No.
If they were having pain, I would ask them how much on a scale of 1 to 10. Any dizziness?
No.
Palpitations?
No.
Have you gained any weight recently?
I have not.
Are you having trouble breathing?
No.
Do you have a cough?
No.
If they were having a cough, I'd ask them if they were coughing anything up and like what color it was. Have you had any cardiac surgeries?
I have not.
Are you on any cardiac medication?
No.
Okay, sounds good. And then on to respiratory questions. First, I would look at their skin color, see if if they look blue at all, or if they're sweaty or pale. He looks pretty good. Are you having any trouble breathing?
I am not.
Shortness of breath?
No.
I would look for obvious signs of distress. They maybe don't realize it, but I would look to see if they're using their shoulders or if it just looks like they're having a hard time, if they've loosened any of their clothes around their chest. And then, do you have any inhalers or medications?
No.
And you said no cough and not coughing anything up.
No.
Is it easier for you to breathe when you stand up? Do you have trouble breathing when you lay down?
It's the same.
Okay. How many pillows do you use at night?
2.
Okay. And at the beginning of this, I would have gotten their like a full set of vitals, which would include the oxygen saturation, which is important for the respiratory assessment. Next, I'll ask some GI and GU questions. How's your appetite?
It's good.
Okay. Have you lost or gained any weight recently?
I have not. No.
Are you having trouble swallowing?
No.
Do you have any food allergies or intolerance?
No.
Are you having bowel movements?
I am, yes.
How often?
They're regular, like once a day.
Okay, sounds good. Have you had any surgeries to your abdomen?
No.
Do you have any abdominal conditions?
No.
Any medications?
No.
Any nausea or vomiting?
I have, I actually have twice, and I've been nauseous all through it. So.
Okay. Any diarrhea?
No.
Okay. All right. Is that what brings you in today?
It is. Yes.
Okay. And then how about your urine? What color is it, would you say?
Like a light yellow.
Okay. Are you going often?
About every 2 hours, 3 hours.
Okay, that's fair. Does it have a weird smell?
No.
Is it painful when you urinate?
No.
Is it about a normal amount?
Yeah.
Okay, perfect. All right, now I'll start with my actual physical assessment. So I'll just have you scoot back. first with neuro, I'm going to use my pen light and just assess his pupils. So I'll assess Perla. Just so his eyes are round. I'm going to shine a light in there. Okay. His pupils constricted, they reacted to light. They're both the same size. They're about 3 millimeters, which is perfect. And now I'm going to check the cardinal points. So I'll just have you follow the tip of my pen. No jerky movements. Go in and out. Perfect. All right. And I'll just look again for facial drooping, things like that. Let's see. I'll have you, I'm going to check your coordination now, so I'll just have you go like this. Perfect. And I'll have you squeeze my fingers, checking for bilateral strength. And I'm just going to do, I'm going to check his feet push pose. So I'll have you push up. Good. Push down. Good. All right. And let's see. Now on to cardiac. I'm just going to look first, see if his chest is symmetrical. And it looks good. Now I'm going to auscultate. So for S1 and S2, this is aortic, pulmonic, tricuspid, and mitral. This is also the location of the apical pulse, so I'll listen for a full minute here. I'm going to listen to the rhythm and rate. So it should be between 60 and 100 beats per minute, and I want it to be regular. And it sounded good. I would listen for any murmurs and things like that. Now I'm going to check the pulses on his feet, and I'll check for edema also. So we'll have this again. So there's no edema there. That's good. So I'll check his pulses down here. Dorsalis pedis and posterior tibial. Respiratory. So I will just I would have him take a deep breath for each of these, but for the sake of the video, I won't make him do that. So there's 6 places on the front. 1, 2, 5, and then 6. All right, and I'll listen in your back. I'll have you stand up and turn around. Let's see. I don't know if you. Perfect. Okay, so then there's 9 places on the back. I'll just have you angle your chair a little bit too. Perfect. So, and another again, a deep breath with each of these. So 1, 2, 4, 5, 6, 7, 8, 9. All right. I listened for any crackles or adventitious sounds. His lung sounds were clear, so that's good. I'll check for capillary refill also. All right, perfect. Less than 2 seconds, which is exactly what we want. And then I'll check, I will inspect his abdomen. He would be laying down in a clinical setting, but we don't have the resources for that right now. So I'll just have him keep sitting. So I would, when he lays down, I would look to see if his abdomen is distended or bloated. I'd look to see if it's concave, if it's shiny, if there's any weird lumps or bumps or anything like that. And then I would listen. I'm going to start in the right lower quadrant, and I would listen for a full minute in each quadrant. And I should hear between 5 and 30 vowel sounds per minute for each quadrant. So starting in the right lower quadrant. Good. And then if there weren't any vowel sounds, I'd have to listen to each quadrant for 5 full minutes before I can say that vowel sounds were absent. And now I'm just going to lightly palpate. I'm not going to do any deep palpations, just to see if there's any tenderness or pain. So just tell me if there's any tenderness or pain when I'm touching your stomach.
Okay.
All right, and like I'd also feel for any bladder distension, but it all feels good. It's soft. There's no hard spots or anything. So I will let your doctor know right away that you're having that knock in front of you, and I will send him in.
Sounds good.
Is there anything I can do for you today?
No, that should be good.
All right, and then as I'm leaving, I would wash my hands.